my name is Shay Reitler, and I will be doing a intramuscular Z-Track method injection. First, I'm going to make sure I have the 6 rights of medication administration: right patient, right medication, right dose, right time, right route, and right documentation. I'm also going to make sure I do my 3 checks before I pull my meds, after I pull my meds, and again at the bedside. So in the medication room for this method, you're going to have a diluent and then you're going to have a powdered medication. So for both, I'm going to check the vials for any cracks. I'm going to check expiration dates. And so I'm just going to open my vials here. And I'm going to clean the top of each. I'm going to select the correct syringe to use. I'm going to uncap my needle. I'm just going to drop the amount of air, and this will be on the powdered. It'll say how much diluent you need for each. Okay, I'm just going to inject that air into my diluent. And pull back how much I need. Making sure I'm getting rid of any bubbles. And I'm just going to inject that into my powdered medication. Pull back, I'm going to recap my needle. Undo this needle, and we'll put this in the sharps. I'm just going to roll my powdered medication to get it all together here. Okay, I'm just going to attach my sterile needle. We'll pull back how much. I'm going to draw back how much I need. Sorry, I'm losing my cap. Okay, I'm gonna recap my needle. Get rid of any air bubbles. Don't seem to have any there. Then when I enter my patient's room, I'm going to identify myself and what I'm doing. I'm doing an intramuscular injection Z-Track method. And Z-Track, you just pull the skin back 1 to 1.5 inches, and then you inject, and then you let that skin go back so it stays trapped in the muscle there. I'm going to identify my patient by name and birthday, check allergies. I'm going to make sure I do have the right med, right dose, right route, and right time. And for one of the other places you can use for an intramuscular is the vastus lateralis. And to identify that, you can feel the greater trochanter. You're going to go about a hand down and a hand above your knee here. And then you're going from the medial to outside aspect here. And just anywhere in there from here to where my hand was, so right here would be a good spot. And I'm going to have my patient lay supine, or they can sit. I'm going to wash my hands and put on my gloves. Okay, I'm just going to wipe that area with an alcohol swab. And then this one is also 90 degrees. With my non-dominant hand, I'm going to pull back that skin 1 inch to 1.5 inches. And then I will go in my 90 degrees. Aspirate. And then inject. And then I can pull back, I can let that skin go. Then I'm just gonna recap my needle, put it in the sharps. I'm just gonna wipe up this area if there was any blood. Put a Band-Aid on if I need to. And then I would just make sure I do my right documentation.